An electronic health record (EHR) system is a network-connected enterprise-wide information system, meaning a hospital can store patient data or they can transfer that data to any place under the network rather than one paper folder. This opens up tons of new ways that people can interact with, such as clinicians, doctors, or insurance providers. Previously, if a person had moved cities, they would have no choice but to get a new doctor who wouldn't be aware of their past medical history. But with this new technology, doctors around can share patient information and transfer it if needed. In the article, I think 10% of hospitals had an EHR system in 2006. And according to the Healthcare Information Management Systems Society, as of last year, 95% of hospitals utilize it. The health field is currently evolving and integrating tech, and the EHR is just one way that technology is being used to make things more efficient.
Hi, I'm Christine, and I'll be talking about the advantages of electronic health records. So depending on the specific environment and the situation that medical information is presented, the features, interfaces, and format of the data may vary greatly. Using paper records definitely limits what can be done with the information and is difficult to easily update. What EHR does is enable the professional medical workers access to the data that they have responsibility over. And with EHR systems, there is an advantage of the resolution of vocabulary variations that bar easy tracking between investigators. Data can be sorted in such a way that it is recognized in the proper context, and integrated architecture can allow for the sharing of data across multiple systems. With the data for patients all in one system, clinical analysis is possible, which means that clinicians can create visual displays, such as flowcharts to monitor health status progression and other information sharing statuses.
Hi everyone, so my name is Arielle, and today I'll be talking about the cons and disadvantages of EHR. One key problem of the electronic health record is the concerns for privacy and security. Because of its accessibility, many physicians and other health professionals have access to the patient's health record. However, there are a set of guidelines that all healthcare professionals must follow to use the system's EHR, but there are still people concerned with the potential breach in security and violation of privacy. As stated in the article, one major critic of the electronic health record, Professor Jacob M. Apple. He believes that because many people, such as patients, physicians, physician office staff, and insurance companies, that all have access to the electronic health record, then a security breach is inevitable. Personally, I think that the electronic health record advantages outweigh the disadvantages of it. Typically, there really is only one disadvantage, which is the privacy and security aspect. But cybersecurity softwares are now developed, and many large tech companies and any companies that just has electronic filing systems or large electronic databases have cybersecurity in place to prevent potential hackers. This is something hospitals can also use. Additionally, in terms of privacy, that's combated with the set of guidelines that are already in place for physicians to follow.
Hey everyone, so today I'll be discussing more on CPOE systems and their current ongoing errors.
You may ask, what is CPOE? What's a computerized physician order entry system, a new innovative way of tracking patient records via technology. We don't have to rely on paper records and can even have remote access to things such as prescriptions, lab results, and x-rays. These systems are quickly advancing, but they still miss many dangerous or even fatal medication errors. For example, according to the Institute of Medicine, the average hospitalized patient is subject to at least one medication error per day, and 40% of these medication errors come from inadequate reconciliation during transitions between different care teams, such as going from admission to transfer and to discharge. So to ensure patient safety, we need to improve the technical errors with the systems, but also while urging all medical providers to step away from paper records, as these CPOE systems are an innovative communication method to assessing a patient's history and their treatment plan.
Within the medical field, physicians and many other hands-on occupations that involve dealing with patients often suffer from alert fatigue. Alert fatigue is essentially becoming bombarded with notifications and requests for help such that the person left responsible for handling them ignores them. It's not ideal, as it could be a life or death situation that's being put on hold as a result of an employee being annoyed or being called all the time for something as simple as getting a glass of water for a patient to, say, somebody suffering from an asthma attack and needs dire assistance. In an article done by Sprint, they addressed the idea of alert fatigue in the sense that not all alerts are made equal. And as a solution to this, they proposed a method in which patients are assigned a given nurse that will be personally notified in case a request for help is being sent. By doing so, there are less people involved with the patient, and therefore responsibility will become heavily placed upon a single person rather than a team of nurses. As a result, the nurse is subjected to less alerts and is less susceptible to alert fatigue. The method proposed by Sprint is pretty good, as it does address the issue of alert fatigue. In my opinion, there's a better alternative that exists that eliminates the amount of liability placed upon individual nurses while also avoiding alert fatigue. I propose we create a gauge system that will record the level of intensity of a request for help and the time at which the request is being sent. By doing so, alerts will be able to address at a much faster rate due to the amount of working bodies available, and priorities are able to be established as a result of the severity and time being factors to determine who needs help. With such a system, we are able to determine which individuals are actually doing their jobs, as they will essentially assign themselves to tasks that will be recorded, and as a result, we are able to improve the quality of care by determining who is actually working in order to save lives and who is just there for a paycheck. It is a high demand to implement such a system like this, but if it improves the quality of healthcare and potentially saves more lives, then it should be implemented.